When it comes to understanding Medicare, it can be confusing and overwhelming with all its different parts. Part A, Part B, Part C, Part D, and even Part E. If you are turning 65 soon or you are already on Medicare, it is critical that you understand the basics of Medicare and how it works so that you have the right coverage. In this video, I'm going to explain and summarize all the different and important parts of Medicare. The Part A, the Part B, the Part C, the Part D, and even the not so known Part E. And hopefully I will make Medicare easy and simple to understand, and you will have a better grasp of how it works and it doesn't work. I will also explain how to cover what Medicare doesn't cover, as in what are your two options for your Medicare coverage. Hi, I'm Chris Prang, the Medicare analyst, licensed insurance agent based out of Charlottesville, Virginia. And my goal is simple. It is to help you make a wise and confident decision about all of your Medicare choices so that you can maximize your Medicare coverage based upon your unique needs, philosophies, and budget. If you want to work with me, please see the end of the video for more information. If today is your birthday, then happy birthday to you. Abhishek Bachchan said, "A birthday is just another day where you go to work and people give you love. Age is just a state of mind, and you are as old as you think you are. You have to count your blessings and be happy." So what is Medicare? Let's start there. Medicare is a federal or national health insurance program in the United States that provides coverage for individuals age 65 and older, as well as certain younger individuals with disabilities or specific medical conditions. The program, Medicare, was established in 1965 under the Social Security Administration and is divided into different parts, each covering specific services. While Part A is usually premium-free for those who have paid sufficient Medicare taxes during their working years, beneficiaries may have to pay premiums, deductibles, and coinsurance for other parts of the program. Medicare Part A, that is your hospital insurance. And this covers inpatient hospital stays, skilled nursing facility care, hospice care, and some home health care. For inpatient hospital stays, this means you've been admitted to the hospital. You are not in the ER, and you are definitely not under observation. All hospital services approved by Medicare are covered. Example, your room, the doctors, medication, treatments, supplies, surgeries, meals, etc. Part A generally doesn't have a premium unless you didn't pay enough into the system. But there is a $1,632 deductible, and that is good for the first 60 days. That is your 60-day benefit period. If you stay longer, day 61 to 90 equals $408 per day, day 91 to 150 equals $816 per day, and day 151 and beyond equals you pay everything unless you have a Medicare supplement or a Medicare Advantage plan. For skilled nursing stays under Part A, this means you have been admitted to a skilled nursing facility for rehab, typically after a hospital visit, such as physical therapy after a hip or knee replacement, recovery from surgery, wound care, etc. There is a $0 copayment for the first 20 days, and then day 21 to 100 equals $204 per day. Days 100 and beyond equals, again, you pay everything unless you have a long-term care policy, and that's a maybe depending on your situation. Also under Part A is your hospice care. This means your hospice doctor and your regular doctor, if you have one, certify that you're terminally ill with a life expectancy of 6 months or less. You may receive care in a facility or at home. You pay nothing for hospice care. You do have a $5 copayment for outpatient drugs for pain and symptom management, and you may pay 5% of the Medicare approved amount for inpatient respite care. Your copayment cannot exceed the inpatient hospital deductible for the year. And then you also have home health services covered under Part A. This means you have trouble leaving your home without help, like using a cane, wheelchair, walker, crutches, some special transportation or help from another person because of an illness or injury. Leaving your home isn't recommended because of your condition. You're normally unable to leave your home because it's a major effort, and it covers physical and occupational therapy, medical social services, durable medical equipment, medical supplies for home use, and you pay nothing for those things. By the way, if you're finding this video helpful and don't want to miss other great content, please consider subscribing. It is greatly appreciated. Then we have Medicare Part B. This is your medical insurance. This covers outpatient care, doctor visits, preventative services, the ER, imaging, and some home health care. Beneficiaries typically pay a monthly premium for Part B coverage. For 2024, it is $174.70. Unless your income is over $103,000 for an individual or $206,000 for a couple, because then you pay an additional premium for the IRMA, income-related monthly adjustment amount. So the more you make, then the higher it goes. The annual Part B deductible is $240 for 2024. Medicare Part B will pay 80% of the Medicare approved amount. You then pay 20% of the Medicare approved amount unless you have a Medicare supplement, Medicaid from the state, or maybe a Medicare Advantage plan. Here are a few important things about Original Medicare that you need to know. Original Medicare Parts A and B does not come with a maximum out-of-pocket limit, meaning sky's the limit if that's all you have for co-payments and deductibles. Original Medicare can work alongside Medicaid, TRICARE for Life, and Medicare supplements. Most providers accept Medicare assignment, but the ones who don't can charge you 15% more than what Medicare allows. Medicare Part C, also known as Medicare Advantage plans. These are private health insurance plans approved by Medicare. They provide coverage under both Medicare Part A and Part B, and they often include additional benefits like vision and dental coverage. This is what you see advertised on TV all the time. My advice is ignore those ads and ignore the phone calls. They are misleading and have caused heartache to millions of seniors and to CMS. They must cover the same procedures and treatments as Original Medicare, but because they are more managed care, you do run the risk of dealing with more prior authorizations and benefit denials. But managed care oftentimes gives you better healthcare outcomes. Medicare Part C does come with a max out-of-pocket limit, typically ranging from $3,000 to $8,000 per year. Sometimes less, sometimes a bit more. Medicare Advantage plans have provider networks, so less access to providers and specialty hospitals. You need to make sure your providers are in the plan's network. You also need to realize that your provider can leave the network at any time. If that happens to you and you're on an HMO, you'll have to find another doctor in most cases. If you're on a PPO, then you may either pay more or less depending on the service, or the same if you have a passive PPO. And as mentioned, they typically come with extra benefits like routine dental, vision, hearing, as well as other perks. But please never ever choose a plan based upon the extra benefits. Medicare Advantage plans typically include your Medicare Part D coverage as well, and you might even find that the drug coverage on a Medicare Advantage plan is significantly less than on a standalone Part D drug plan. If you move, then you will likely need to change your Medicare Advantage plan. Okay, Medicare Part D offers prescription drug coverage through private insurance plans that are approved by Medicare. Beneficiaries can enroll in a standalone Part D plan to add prescription drug coverage to their original Medicare, that's your Part A and Part B, or choose a Medicare Advantage plan that includes prescription drug coverage. Not all drug plans are created equal. You need to pick a plan based upon your unique medications and your pharmacy of choice. You need to check your plan every year during the annual election period to make sure you still have one of the lowest overall cost plans available to you. And you can do that by using Medicare.gov's prescription calculator, or contact me or some other good agent, or in some cases, a local nonprofit. Medicare Part D has 4 stages. The deductible stage, right now currently up to $545 per year, and these deductibles can vary based upon the drug tiers. Not all plans will have a deductible stage. Then you have the additional coverage limit that goes from $0 to $5,030. You will have co-payments and co-insurance during that stage. Then you have the coverage gap, and that goes from $5,031 to $8,000. This is the retail cost of the drugs, not what you are paying out of pocket. Typically during the coverage gap, you will pay 25% of the cost of the medication regardless if it is a generic or a brand name drug. And the last stage is catastrophic coverage. Once you've gone over $8,000, you've hit catastrophic coverage and there is now a zero cost for that. Ironically, usually the lower premium plans suit the majority of people. So don't pick a plan with a high premium thinking it will be better because odds are it won't. All right, Medicare Part E. Perhaps you've been wondering what I am talking about when I refer to Medicare Part E. So most people, even some agents, haven't heard of Medicare Part E. So what is it? Or better yet, what was it or what will it be? So when you think E for extra or E for everyone or Medicare for all. The idea of universal health care or Medicare for people of all ages has been bounced around for years. In more recent years, Senator Bernie Sanders and others have been advocating for Medicare Part E. Right now, if the estimates are correct, about half of the population is on some form of government subsidized health care, whether it's Medicare, Medicaid, or an ACA plan. That's Affordable Care Act. Is there a future for Medicare Part E? Possibly, if the insurance companies were part of the picture like they are now with Medicare Part C, state Medicaid plans, and government retirement plans. If Americans as a whole were healthier. Example, Singapore offers universal health care, is usually ranked as one of the best healthcare systems in the world, but they also have one of the healthiest populations, and that goes a long way. So if governments, providers, research facilities, pharmaceutical companies, and citizens can truly work together, then yes, Part E could happen. What about covering what Medicare does not cover? This is where you and I come in. It is very important to note that Medicare doesn't cover all medical expenses, and there may be gaps in coverage, especially if you want alternative medicine. There are primarily two ways to cover and protect yourself above and beyond Medicare. First, you use original Medicare plus a Medicare supplement and then plus a Part D drug plan. Second, you would go with a Medicare Advantage plan to cover all your Part A, Part D, and Part D drugs, but still pay, in most cases, the Medicare Part B premium. If you are on both Medicare and Medicaid, then you are known as a dual eligible. Then you could do either option one, but no supplement because your Medicaid acts like the supplement, providing you have full Medicaid, or option two, where Medicaid will cover your normal copays on the Medicare Advantage plan. And you can watch my other videos that go over picking the right option for yourself, the top 10 things you must know when choosing a Medicare Advantage plan, and turning 65 soon, which Medicare supplement is best for you. When you want my assistance and you're from one of the states that I do business in, which is California, Florida, Georgia, Illinois, Maryland, New York, North Carolina, Ohio, Pennsylvania, South Carolina, Tennessee, Texas, and of course, Virginia, then please reach out to me. We will have an open and honest conversation about your healthcare needs, your philosophies, and your budget. I will review your medications to find the lowest overall drug plan for you. We will discuss which route is best for you, and I'll get you quotes for different Medicare supplement options. Then once you decide, I'll enroll you in the plan or plans of your choice, and then be there down the road should you have any questions, concerns, or need to review and or change your coverage. And so you know, while I don't represent every insurance company that offers Medicare plans, I do represent every major insurance company that offers Medicare plans, and odds are one of those is going to be best for you. I'd be honored to help you out, and there's no cost to you or obligation. You will need to e-sign the Medicare required scope of appointment document at least 48 hours prior to us discussing any plan info when it comes to Medicare Part C or Part D. I don't like the rule, but I must abide by it. But we don't need it to discuss Medicare supplements or to have a general review. That is it for today. I hope that I have made Medicare a little bit more simple and you can understand it better. I'm Chris Prang, the Medicare analyst. Make it a really great day.